Good morning, and thank you for joining us for today's press call on the recent poll results regarding AI in healthcare that we are releasing today. My name is Kevin Perez-Allen, Chief Communications Officer for United States of Care, and I will be your host today. Artificial intelligence has the potential to transform healthcare, but public sentiment is mixed. With significant concerns about privacy, transparency, and equitable implementation. Our recent poll conducted in partnership with Morning Consult sheds light on these important issues and offers valuable insights into how demographics view the integration of AI in healthcare. Speaking on today's press call are Dr. Venice Haynes, Senior Director of Research and Community Engagement at United States of Care, and Kristen Wakilius, Chief Program Officer at United States of Care. After they go through the findings and methodology behind the poll, we will have a question and answer session. Just a quick housekeeping reminder, this call is being recorded. A link to the recorded call will be mailed to all registered attendees in a follow-up email from United States of Care. As I mentioned previously, after hearing from today's speakers, we're going to open it up for a Q&A session. So to ask a question, please use the Q&A function located on the bottom of your screen. And if possible, specify to whom you would like your question directed. So with that out of the way, I am now going to throw it over to Dr. Venice Haynes, who will get us started.
Thank you, Kevin, and thanks everybody for joining us. We're really excited to get some of our findings from our recent poll on the public perception of AI in healthcare out to you all. So if you go to the next couple of slides, we're going to skip through this to talk about the methodology before we get into the meat and potatoes and why you're all here. So just a quick word. USofCare partnered with Morning Consult to conduct this poll, and it was fielded between May 30th and June 2nd of this month. We had a nationally representative sample of about 2,517 people, including an oversample of 300 AAPI plus Black and Hispanic adults, so people of color. The reason we wanted to do this oversample was to gain a deeper understanding of how people of color are thinking about AI in healthcare, given the backdrop of existing racial inequities within the healthcare system. Here you will see a numerical breakdown as well as a definition of the populations that are included in the sample. And also a note that we define the differences between high, low, and no knowledge of AI, as well as high, low, and no users of AI for context. And we consider this to be a really important contextual variable to consider when we look at the responses to the various questions in this poll. Highlighted here, you will see a portion that is to signal, as the majority of our sample, that really signals that the majority of our sample did not really know much about AI, and that's the knowledge base for how they are coming to this survey. So if we go to the next slide, let's get into why we're all here. We have 4 key takeaways, and at the highest level, what we're seeing is that people are generally not really familiar with how AI can show up in a healthcare setting, right? And so when it came to their own personal care, people seem to be a little bit divided on how they felt about AI in a healthcare setting, where many people felt kind of uncertain or concerned, and about 1 in 4, however, felt optimistic, and then another quarter felt comfortable or excited. And so we'll get into the details of that breakdown a little bit. Our third key takeaway is that people felt that there were tasks that could mostly help, tasks and responsibilities during their healthcare visits, but we're a little more concerned about other things like job security of healthcare workers and some of the potential negative impacts that people who have already been marginalized by the healthcare system would experience, in particular, people with low income, disabilities, or people of color. We'll also break that down a little bit too. And then the final key takeaway is that there was a wide bipartisan agreement among registered voters who wanted to see some action taken by policymakers and Congress to regulate the use of AI in the healthcare industry. So let's get into it. If we go to the next slide, here's how our general awareness broke down. And essentially, what we are seeing when we ask people about their feelings about the use of AI in healthcare was a bit of a lukewarm response. And I know that can sound a little vague, and that is because by design, we had respondents gave them the ability to select multiple answers. And so this is how, essentially it broke down. There was a mix that leaned slightly more uncertain and concerned and skeptical, while there were some that leaned a little bit more optimistic, comfortable, and excited about the use of AI in healthcare. And so we followed up with a question about what we thought or what they thought these feelings were based on. And a majority of the sample said that it was due to either what they heard in the news or on social media. No, probably no surprise there. So on the next slide, if we look across different segments of our sample and how this broke out, we saw that Hispanic and Black adults were significantly more likely to be comfortable with the use of AI in healthcare, while white adults were more likely to feel uncertain and concerned about it. So that was a particularly interesting finding when we started to segment some of these groups out. So on the next slide, we recognized when we were developing the survey that this conversation has been brewing well over a year now. And so we wanted to check in and see at this point if people had actually experienced the use of AI in their own healthcare visits. And so we broke these findings out by age and race ethnicity. And we see here that a majority of the sample across the board had not yet had an experience, had AI included in their healthcare experiences. And we asked if about their visits within the last year, just for a little background there. And so interestingly, we see that more Black respondents reported having experienced AI during their recent visit compared to any other racial group. If we go to the next slide. So we wanted to follow up with some other listening work that we had done to get a sense of what people know about it and how aware they are in terms of where AI could show up. And so when we asked about a number of potential use cases for AI in healthcare delivery in terms of what they were aware of, um, and what was possible, we found that a majority of the sample was not really aware at all of any of these use cases for AI when we gave them these examples. And so that all ranged from managing medical records, analyzing tests and imaging, processing insurance claims, detecting major illnesses like cancer, and even training physicians. And so interestingly, we saw that the management of medical records is where if there was awareness, that's where most of the awareness occurred, right around at 49%. So on the next slide, we looked at these findings across a few of our demographics, and we see here that millennials and Gen Zers in the sample were much more aware of where AI could show up in healthcare, as were Black adults compared to Gen X and baby boomers and other ethnic groups, respectively. So while some people were comfortable with the use of AI in healthcare, our sample indicated that about 1/3 of people didn't really want their physicians to use AI tools during their healthcare visits, which we thought was interesting. This showed up primarily among Gen Zers, Hispanic, and Black adults. However, the plurality of the sample said that it was okay to use these tools sparingly or occasionally, depending on what the task was. So, what does that actually mean? Let's go to the next slide. We brought back some of the use cases and asked about how comfortable they were again. About half of the people in the sample said that they would actually be comfortable with AI recording the visit to help with note taking. They'd be okay with AI being used to communicate test results via chatbots. review images or scans, and manage medical data and their medical history to basically give a holistic summary of their medical background. So that was okay. An interesting finding here is that people of color were much more prone to be comfortable with the use of AI in some of these scenarios compared to white adults in the sample. So related to that, we wanted to put forth, a few more scenarios to understand, based on the participants' understanding, how they were viewing some of these use cases in terms of whether AI would help or harm existing challenges in the healthcare system. And so overall, while over half of the sample viewed note-taking during doctor's visits to be a plus in managing medical records, they also recognize that this could be a potential threat to job security for potential healthcare workers. And this is an area that could have a negative impact. So one of the features of this particular poll, if we go to the next slide, that we wanted to make sure, we paid very close attention to was the role of AI in health equity. And so when we got into the findings on some of this, we wanted to kind of set the tone and gain the sample's understanding about how they were thinking about or where people were most likely to, what groups of people were much more likely to experience unfair treatment within their healthcare experiences. And respondents indicated that people with low income, people with mental health concerns or substance use disorders, people with disabilities, and people of color were the groups that were most likely to encounter unfair treatment. We also see that Black adults were significantly more likely to think that these same groups experience unfair treatment compared to any other age or ethnic group within this sample. Next slide. And so when we asked, generally 1 in 4 adults in this sample believe that AI would actually increase bias for people with low income, mental health concerns or addictions, certain age groups, people with disabilities, and people of color. And we see this again where Black adults in the sample were significantly more likely to think so, particularly among people with mental health and substance use disorders and people with disabilities. Next slide. So compare that to nearly a fifth, which is around 18% of the sample that believe that AI would actually decrease bias, particularly among people of low income, people of color, and those that identify as LGBTQ+. When you look at the group of Gen Zers in the sample, that number goes up to about 21 to 22%. So what are we talking about here? If you go to the next slide, when we followed up with the question about why they think that this would be the case, right? What were some of the reasons that think AI would increase or decrease bias for certain groups? 40% of those that said AI would decrease bias believe that human bias was actually not involved in AI and is fairly neutral, compared to 34% of the sample said that AI would increase bias, believe that human judgment indeed is still involved in medicine and could factor in to their healthcare experience. So if we go to the next slide, on a related but broader note, we've heard a lot in our previous research that people largely do not trust the healthcare system. And so we wanted to make sure we asked the question when it came to AI about the degree to which they thought AI would increase or decrease their trust in the healthcare system. Here's what they said. Basically, about a third of adults think it will increase their trust. A quarter said it would decrease their trust in the healthcare system, and another third said their trust would not change. So essentially, people are kind of across the map on this, and it probably has a bit to do with their lack of knowledge about how AI is operating in healthcare writ large. So then we followed up about confidence, and when we asked if there were potential risks and fears were addressed, how would that impact their comfort level? And while some felt they would be more confident if privacy concerns and the potential for error were reduced, that's about 34%, a majority of the sample said that AI would neither decrease or I'm sorry, would neither make them more or less confident, even if all of these risks were addressed. Again, to my earlier point, likely because people need to know more about it, and so they took a fairly neutral stance here. An interesting finding was that among people of color, we saw that about 34% of Black adults were significantly more likely to have increased confidence in AI if bias and inequities in the healthcare system were addressed, compared to Hispanic and white adults at 30% and 29% respectively. So that is one to pay attention to. So let's shift gears a little bit and talk about the legislative sentiment that came out of this poll. One of the most interesting findings was that about 43% of registered voters across party lines agreed that AI is currently not well regulated. And 63% of voters also agree that it should be regulated by policymakers. Next slide. When we asked about who should be accountable, should something go awry or a medical error was caused by AI, there was still high bipartisan agreement that the health system or hospital where the error occurred should be responsible. And you can see the breakdown here across party lines. If you go to the next slide, going a little bit deeper, we asked respondents about how appropriate they thought it was for Congress to get involved in various scenarios we saw that a majority of the sample, about 77%, thought that it was appropriate for Congress to get involved in protecting patients' privacy and data, with 54% thinking it was extremely important or extremely appropriate for Congress to get involved. We also saw overwhelming support for Congress to get involved in requiring safeguards for government health institutions like the FDA, NIH, et cetera, and making sure that there was transparency for how the AI developers was going to use the technology and how that was going to impact the patient experience. We also saw a desire for oversight of AI developers and companies overall. And again, when we look across party lines for the support of these options, the sentiment of strong congressional oversight remains extremely high across the board, particularly around protecting patient privacy and data. So no surprise there. So essentially, I've said a lot. What are we saying here? In summary, people are really lukewarm about the use of AI in healthcare. They don't really know a lot about it. Most have not had an experience with their most recent doctor visits. But there are certain instances where they are likely to feel more comfortable with its use, such as note-taking and coalescing medical records. They recognize that in these same situations, AI could mostly help, but it is not lost on them that it could also threaten the job security of some healthcare workers. And when it comes to health equity in AI, people recognize that inequities in healthcare do still exist, and also recognize that AI has the potential to exacerbate these inequities for people with low income, people with mental health and substance use disorders, people within certain age groups, and for people of color. Many say their trust and confidence in the healthcare system will not really change much due to the use of AI, and are adamant that policymakers and Congress get involved to regulate AI, especially around patient privacy, security, and not exacerbating existing inequities in the system. So with that said, I will turn it over to my colleague, Kristen Wikilius, who will talk to us about the federal and state landscape. Thank you.
Thanks, Venice. Given registered voters' strong support for policy action that Venice just outlined, it's certainly not a surprise that AI in healthcare is gaining traction among policymakers. I'll walk through what we're seeing in the federal landscape, followed by state actions. At the federal level, overall, the majority of concrete action has been administrative in nature, with executive actions from the Biden administration driving the federal government's response to emerging AI technologies and the questions that they pose, while congressional activity has focused primarily on building a knowledge base and identifying potential issues and actions for future legislative activity. And this interest and attention has largely spanned party lines. Next slide. The Biden administration has taken a series of actions to shape the federal government's approach to AI overall, including AI in healthcare. And this began in 2022 with the executive blueprint for an AI Bill of Rights, which laid out key guiding principles for automated systems. The administration then followed this with an executive order in October of 2023, which laid out a number of focus areas across the federal government, including for health and human services regarding safe and responsible AI use. From a healthcare perspective, this executive order included calls for sweeping protections for patients interacting with AI in healthcare systems. And as a part of this, HHS created an AI task force in January of this year, which will release regulatory frameworks within a year of its creation. Next slide. HHS has already taken several concrete steps in response to this executive order, which laid out a number of priorities for the administration to accomplish in its first 180 days. They released a plan with guardrails and principles for responsible use of AI, announced a final rule clarifying that non-discrimination requirements in healthcare programs and activities continue to apply when AI is being used for clinical care or in predictive analytics. And they also developed a strategy for AI safety in healthcare, which outlines additional frameworks for AI testing and evaluation and future actions for HHS to promote responsible AI deployment. Next slide. Looking to Congress, Congress has not yet begun to seriously consider legislation to regulate the use of AI in patient healthcare interactions, and really so far is focused on understanding the policy and technology landscape that will guide a lot of these ultimate decisions. Members of Congress are certainly aware that there is a need to understand the implications and the use of AI in healthcare, and really have begun to explore how tech developers are building out AI models and what guardrails could be put in place to protect people and mitigate against bias without blunting innovation. As a part of these efforts, the House has established bipartisan caucuses and task force to begin to better understand this emerging landscape, in addition to the new House Digital Health Caucus and the House Bipartisan Task Force on AI, which was created by Speaker Johnson and Minority Leader Jeffries. The House Energy and Commerce Committee has also considered legislation more broadly around data protection and transparency, like the American Privacy Rights Act, which, as a broader data protection and privacy bill, also would give consumers the right to opt out of the use of algorithms for certain decisions, including some related to healthcare. Next slide. In the Senate, activity has centered largely around the Senate's bipartisan AI working group. And this group released a roadmap report in May of this year based on 9 AI Insight forums that they held. And this report gives committees instructions to explore AI-related committee-led legislation, and also lays out some areas of what this activity could look like. And overall, the AI working group wants Congress to explore regulations that support and don't stifle the development of AI tools. We're certainly expecting to see more legislative proposals coming from both houses of Congress next year, after committees and caucuses have had more time to study these emerging issues and develop potential legislation. And regardless of congressional control and the outcome of the presidential election, AI and its implications for healthcare will continue to present important questions that both Congress and the administration will need to confront. Next slide. And we can go to the next slide. Looking to states, we see states jumping in to this debate more quickly than Congress, with bills being introduced and considered in several states this year. This year, we saw legislators in 12 states introduce proposals that were specific to AI in healthcare, with more than a dozen other states considering legislation that focused on AI more generally, but would have implications for healthcare. And similar to Congress, these state discussions have largely been bipartisan in nature, and issues related to AI have been on legislative agendas in red, blue, and purple states, as evidenced by this legislative landscape. Next slide. Several key themes are starting to emerge in legislation in states across the country. We're seeing bills focusing primarily on patient notification, data privacy, the impacts on health equity, and then the use of AI in insurance coverage decisions or provider clinical diagnoses. And legislators are tackling these buckets of issues in a few ways, with proposals largely focusing on implementing impact assessments from algorithms, requiring clinical supervision of AI tools, ensuring that there is patient notification and consent for the use of AI tools, and very commonly authorizing a study or a task force, similar to the caucus approach that we're seeing in Congress, to more closely examine key issues and lay out pathways for future legislative action. Very few of these bills became law this session, with the majority of bills that did pass setting up task forces or approaches for further study. Though we believe that introduced bills are often a very strong indication of where debate will head in future sessions. So expect to see these states and others pick up many of these similar issues in legislative sessions next year. Next slide. An example, this pending bill in New Jersey is a great example of the types of proposals that state legislators are considering. This legislation focuses on how AI is being used for coverage determinations, and it creates a public disclosure requirement if insurance carriers use an automated system. And several states, including New York, Oklahoma, and Pennsylvania, considered similar bills regulating the use of AI-based algorithms in health insurance utilization reviews, all with the goal of ensuring that these coverage determinations have some element of human oversight. So that's a quick summary of the state and federal activity that we're seeing play out. And Kevin, I will hand it back to you for Q&A.
Thank you, Kristen. As she mentioned, we're now going to move to our Q&A session. So please use the Q&A function to submit your questions, and I will read those aloud to our speakers. And again, if possible, please let us know to whom you want your question directed. So right now I have a couple. So I'm going to start with a notable portion of respondents expressing skepticism and concern about AI in healthcare. What steps can healthcare providers and technology developers take to build public trust and ensure equitable implementation?
I am happy to jump in and take that. I think one of the key things that needs to happen as this is coming on the scene is education. People don't know what they don't know. And it is, I think, the job of those that are using it, implementing it, testing it, whatever the case may be, to educate patients and the public on um, not only the how, but the why, right? Let's talk about the benefit of what AI can do, why it is here, why it is being integrated, so that people can have a fully informed, understanding about, why the change, why this new thing, what is it supposed to do? And then coupled with that, I would say is transparency. And part of that education is being transparent about what their data is built off of, where it is going, what it is going to be used for. So.
Great, thank you, Venice. Another question here. What role does the United States of Care see for patient advocacy groups in ensuring that AI technologies in healthcare are implemented ethically and transparently?
I'm happy to hop in and take this one. I think, in short, the role that patient advocacy groups need to play is bringing these perspectives that we heard from people to the policymakers that are making decisions about what AI is going to look like in healthcare. And so that's patient advocacy groups listening to their members, understanding the types of transparency that we hear that they want, the types of regulatory approaches that we know that they want, and making sure that those perspectives and not just those of industry or health systems are the ones that are shaping administrative and legislative proposals that we know we're going to see start moving at both the state and federal level.
I'll jump in to add to all of what Kristen said. Totally agree. I think there needs to be a level of accountability. As more regulation happens, as they are listening to patients, as they are feeding up into advocacy efforts, there needs to be some consistency. And I think we saw this from, from some of the poll findings that the implementation of this needs to be needs to have a continuum of transparency, but there's accountability to that and where their information is going, and how processes are developing. I know this is a very fast moving issue, so to speak, but making sure that those that are in charge of implementing or making regulatory suggestions or requirements are accountable to implementing those, and that they are transparent, and there's a feedback loop created to continue to build the patient's trust.
Thank you, Venice. Excellent. Last question here, and I think this might be for both of you, but a little more heavily for Kristen. How can policymakers balance the need for innovation in AI healthcare technologies with the public's call for accountability and strict regulatory oversight?
I think on this, I would pick up right where Venice left off, which is around transparency. I think, our results show that people are, interested in learning more about AI, and they want to know when and where it's being used in their care. And so I think there are ways for policymakers to balance the promise of some of these innovations with guardrails that meet the public's desire for knowing how and where these tools are being deployed so they can understand more about them and understand how they might impact their healthcare experience.
Great, thank you both. So if anyone has additional questions or would like to speak to Kristen or Venice or anyone else on our team, please feel free to send an email to communications@usofcare.org. We want to thank everyone for their participation, and obviously a very special thank you to our speakers, Kristen Wakilius and Dr. Venice Haynes, for their time, their insights, and their hard work. Thank you for joining us, and have a great day, everyone.